University of South Alabama, and this is for my advanced assessment class. This is Mr. Smith. He's 51 years old. He is a white male. He came in for his annual physical. He's already had his weight taken, and he was 200 pounds. His height was 5'7". He's also had his vital signs assessed. Heart rate was 76. His blood pressure was 127/72. His respirations were 20. His temperature was 98.4, and he's not on any prescription medications. He takes a multivitamin and enteric-coated baby aspirin daily. He's had past surgeries, which include a lap chole about 5 years ago, a right hip surgery when he was in his teens, a left ankle surgery about 25 years ago, and he has also had some oral surgery done in the past, and his tonsils taken out as a child. Okay, now we're going to begin our head-to-toe assessment. I have washed my hands and I have put my gloves on. So we're going to start with the head, inspect the head, good size, normal cephalic head, thinning hair, losing a little bit of hair on top, no lesions, no abnormal masses, and clean, and no signs of dandruff or scaling. And we're going to go to his ears, which are, inspect the ears. You have the tragus, the entotragus, the lobe, the auricle, helix and antihelix, and mastoid process, just right behind the ear. Okay, we're going to look inside the ear, and we're going to assess his cranial nerve 7 acoustic as well. Internal canal is clear. It's free from exudate. Tympanic membrane is gray. See the cone of light, the malleus. Tympanic membrane is white peripherally with center concave and no perforations. Right side, the ear canal is free from drainage. Tympanic membrane is also gray, white peripherally. Cone of light is seen. Malleus is seen. Center is concave without perforation. Okay. Now, we're going to test your cranial nerve for your optic, ocular motor, your trochlear, and also your abducens. Your optic, we're going to look at the Snellen eye chart. So if you'll stand, please. 20 feet this way. If you'll cover one eye, and read the smallest set of letters that you can.
Line 8. D-E-F-P-O-T-E-C.
Okay, if you'll cover the other eye. This is your right eye you're looking at.
Line 8. D-E-F-P-O-T-E-C.
Okay. All right, if you'll walk back this way, please. Okay, now an eye chart indicates each line is at 8 is 20/20, which indicates what a normal person can read from 20 feet, and So line 8 was 20/20. And the higher the denominator, the worse the division. Now we're going to do your ocular motor, trochlear, and your abducens, which is 3, 4, and 6. Okay. If you'll look at my finger, we're going to do the 6 cardinal gazes. Up. Okay. We'll look at my finger and look at the wall behind me. Back at my finger. Okay, back at my finger. Pupils accommodate. Okay, so look at your pupils. Pupils are about size 4 millimeter. Pupils constrict, they're round. They constrict. Pupils equal round, reacted to light, and accommodate. Okay, if you close your eyes. Any tenderness?
No.
Okay. Any tenderness in your frontal sinuses?
No.
Tenderness in frontal here?
No.
Maxillary sinuses?
No.
Okay, you can open your eyes. Okay. Eyelids, half over the iris. Eyes are free from exudate. Eyelashes are turned outward. Lacrimal system, no excessive tearing, nor exudate. If you look up, conjunctiva is pink and moist, no exudate. Look down. Conjunctiva is pink and moist, no exudate. Sclera is white, bilaterally. Okay, your nose. Nose is fairly symmetrical. If you look up. No drainage. We're going to also check your olfactory cranial nerve, which is cranial nerve 1. If you place your finger on one side of your nose and breathe through the other. Okay. Switch sides. Okay. Both nostrils are patent. Close your eyes. Occlude one side, please. Do you smell?
Maxwell House.
Okay. Occlude the other side.
2 cups.
All right. All right. Now, I'm going to palpate your temporal artery. Equal on both sides and palpable. TMJ. I'm going to assess your cranial nerve 5, which is trigeminal. You can open your eyes. Open your mouth. Close. Any pain? Clench your teeth. Any pain?
No.
All right. Now if you'll close your eyes and tell me when you feel the sensation.
Yes. 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 Yes.
Okay. Cranial nerve 5 is intact. Okay. Now we're going to assess your facial nerve, which is cranial nerve 7. Okay. Now if you raise your eyelids, eyebrows, I'm sorry. Smile. Show your teeth. Okay. Puff your. All right. Good. We also need to check your eyes. I'm going to look inside your eyes, inside the pupils. I'm going to dim the lights. Okay, you look straight ahead. creamy yellow. Look straight ahead, please. Red reflex. And optic disc present. Quadrant. Positive normal vowel sounds, right upper quadrant. Positive vowel sounds, left upper. Positive vowel sounds, normal vowel sounds, left lower quadrant. Okay? Abdomen is, there is a scar just below the umbilicus from lap chole, along with a scar right upper quadrant, 2 of them, from the lap chole. I am going to do some light palpation to your abdomen. Just let me know if there's any tenderness. Tenderness? Tenderness?
No.
Tenderness?
No.
We'll check for rebound tenderness. I'm going to push in and out. In pain?
No.
Okay. I'm going to percuss the abdomen. Dullness when I come to the liver area. For the stomach, a little tympany. I'm going to do deep palpation for the liver. Well, actually, I'm going to find the borders for the liver first with percussion. Deep breath. I'm going to try to palpate it deeply. Put my hand under the 12th intercostal rib. Okay. Take a deep breath. Sorry. Deep breath in. Unable to palpate the liver. There's no gallbladder. Gallbladder was taken out before. Now I'm going to try, let me get back on this side because it's actually easier to try to palpate your spleen. I'll put my hand under about the 12th intercostal space. Okay, deep breath. Pain? Any pain? No. I'm able to palpate. Listen for the aortic pulse. Plus. listen to the femoral artery. Plus, sorry. Two plus. Both femoral arteries were palpable. Okay, we're going to go into the lower extremities. Legs, hair evenly distributed, no lesions, no cuts, no varicosities. There is a scar on the left lower kneecap, patellar, or the patella. Looks like from some accident, no surgeries there, right? There's a scar on the inside the left ankle, legs together, feet up. Right leg is about 2 centimeters shorter than the left leg due to injury when he was in junior high school. He had a right hip surgery. Also, he has a scar on the lateral side of his right leg. We're going to check for pulses. Dorsalis pedis, 2 plus, equally. Posttibial, 2 plus, equally. Capillary refill, less than 3 seconds. Feet are cool to touch. No lesions. Let's try to check your popliteal. 2 plus popliteal, right leg. 2 plus popliteal in the left leg. Okay? I'm going to check for Homans, if you will. Any pain? Okay. Negative for Homans. Pain? On your calf? Negative. So now we are going to check for Babinski. Okay. Negative both sides, bilaterally. Okay, now if you will sit up, please. Okay, I'm going to check for reflexes, deep tendon reflexes, which is your tricep reflex here. Just relax your arm. Check for this one. Relax your arm. Okay. 2 plus on both. And now we're going to check for your just relax your arm. Your bicep reflex. 2 plus. Okay. 2 plus. Now radial pulse. Here, just lay down. Okay. 2 plus. 2 plus, patellar, Yeah. So I was trying to get out of your reflex. Okay. 2 plus, fall laterally. And I do need to do the Achilles tendon reflex. Thank you. Here. Okay. Okay, 2 plus bilaterally. Okay, now I'm going to check the strength in your legs. As I push against the outside of your legs, you'll push toward my hands. Because we're going to check the abduction. Okay, push. Okay, good. Equal strength bilaterally. Then you're going to push against my hands toward the center for adduction. Okay? Equally, muscles are equally strong. Squeeze my fingers. Okay, bilateral grips are equal. Okay, push down on my hands. Flip yours over. Push up. Muscle tone. Upper extremities are equal. Now I am going to check your brachial pulse. Two plus. 2 plus. 2 plus. 2 plus. Okay. Now we will put your gown on. Drape you. We're going to check your coordination. You can do some of this sitting and some standing. All right. You're going to take your hands. You're going to touch your fingers. And get a little faster each time. Okay, good. Now you're going to lay your hands on your knees, palms up, and flip them over. Back and forth. Faster. You're good. Okay, now you're going to stand, do the tandem toe, heel to toe. Walk, one in front of the other. Okay, good. Turn around and walk back. Good. Okay. Patient's gait was steady. Did not lose balance. Now, now what I want you to do is put your hands to your side, feet together, close your eyes. The Romberg test. Okay, open. And now put your arms out to the side. And you're going to touch your finger to your nose, each one. Other one. Go a little faster each time. Okay, good. Okay, now just sit back down. I'm also going to check to see if you can differentiate between sharp and dull. I'm going to have you close your eyes, and this is dull, this is sharp. Got it?
Got it.
All right. Got your eyes shut?
Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull.
Your eyes shut?
sharp, 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 dull, 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 sharp, dull, dull, sharp.
Okay, good. Okay.
Did I pass?
Yeah, I think you passed. You did well. That's the end of my assessment video.